On this Health and Wellness Thursday, you may not be aware of this, but a third of Americans do not seek medical care because they're worried about being blindsided by hidden costs. Well, I recently spoke with patient right advocates to find out more about what you can do to avoid hidden costs while still getting medical care. Here's more.
Do you know anyone who has been blindsided by a medical bill? You are not alone. 61% of Americans have been hit by an unexpected medical bill, and for many, those costs have led to financial devastation. Cynthia Fisher is the founder of PatientRightsAdvocate.org, and she is joining us to discuss why during this pandemic, the need for price transparency has never been more important. Thanks for talking with us, Cynthia.
Thank you, Christine. It's a pleasure to be here.
And such an important topic, especially right now. So what is the status of legislation that might give Americans the protection they need?
Well, we recently had a huge victory for American patients. In fact, all Americans, in that just recently on the Senate floor, a bill was introduced called the Healthcare Price Transparency Act. This bill is introduced by Senator Braun and Senator Chuck Grassley and many others. And what it does is it makes hospitals show their discounted cash prices, as well as hospitals and insurers revealing their secret negotiated rates so that all patients can see prices before we get care. And consumers of healthcare will be able to shop for the best quality of care at the lowest possible price. This is huge because consumers know when we're in control of our precious hard-earned healthcare dollars that it'll be us who will reduce both the cost of care and coverage by benefiting from competition and choice.
How can system-wide healthcare price transparency save every American money, but also stimulate the economy?
Well, 90% of all Americans want price transparency in healthcare. They want hospitals to reveal these prices. When we can see prices, we know we can save. How? Employers that have already contracted with price transparent providers are saving 30 to 50% for their workers in their plans, both on care and on coverage. This is huge. And with this bill becoming law, and hopefully in this next stimulus package, it will be put into law. As early as next year, all Americans could save 30 to 50% because we would see prices in healthcare. That's huge. And to our economy, economists such as Art Laffer and Steve Forbes estimate that over 1 trillion a year would be saved by our government. That's 1 trillion every year put back into the pockets of the taxpayers.
That is huge and so many benefits, but what else would be advantageous if it does pass?
Well, when 90% of all Americans want this, we certainly hope it does pass and that Congress actually listen to the consumers rather than the hospitals and the insurance company lobbying organizations. So it's time to put patients first over profits and let us be in control of this very, very precious dollars, especially in these devastating COVID times. It'll be a huge economic stimulus to all families and to businesses, as well as to our economy. And your viewers could go to our website, PatientRightsAdvocate.org, to learn more and click on a button and let Senators Romney and Senators Lee know that they need to sign on and provide healthcare price transparency for all Americans.
Well, thank you so much, Cynthia, for talking with us today and helping us understand this important issue.
Thank you.